Morning. So my name is Rebecca Leon, and my presentation is From Chaos to Coordination, Elevating Education for Oncology Nursing Workflows. So the background of this project is that we actually, at a multi-site cancer institute, created and implemented a new charting software within our Epic MyChart system for prepping of visits. So this was rolled out with our clinic areas, so surgical oncology, medical oncology, radiation oncology, and now we're working on rolling it out for our infusion areas as well as our intermediate care center, which is almost like an urgent care for our patients, as well as our phase 1 clinical trials unit. So with that, our nurses reported an inefficiency in workflows prior to this charting system because every single clinic, which is about 29 departments, all had their own version of how to complete this. So with that being said, when we created this standardized workflow, Epic was very new to our areas, so we needed to be able to implement a training plan that made sense for our nurses to actually get them on board. With that being said, we did a multi-step kind of system, which we did our initial office hours training when it went live in Epic, which essentially was a down and dirty of what it was that we were doing and how we were doing it to give nurses that support. With that, we did some real-time support and troubleshooting to introduce the new workflow, as well as creating videos that we were able to actually embed in Epic so nurses would have it as just-in-time training. And we were able to create educational handouts as well as a presentation to actually give to nurses so that way they knew step-by-step exactly what they needed to do. From there, we introduced our oncology ambulatory clinic class for new hires, which we also encourage our experienced nurses to come to, so that way they can also get up to date on any changes or any modifications that we have in our workflows, but the first 2 hours of this class is specifically dedicated for this workflow. With that, we had our office hours as well, in addition to that, which happens every other month. It's about 4 hours, and those happen virtually, whereas the class itself happens in person, and it's a full workday for our nurses. With this virtual office hours, people are able to drop in as it makes sense for their work schedules to actually be able to ask their questions, get any real-time support, or just get anything that they need about what any of our workflows are, not just this one in particular. So it's been a really well-rounded approach to be able to supplement a lot of the workflows that we already do, especially because a lot of our new hires are also new to oncology, which makes a huge difference. And even for our nurses that aren't new to oncology but are new to our clinical areas, it makes sense because that way they're able to really figure out what that Emory workflow is, because we work at Emory Healthcare. Some of our results is that utilization, especially after implementing all of these interventions, utilization doubled, which was huge. When we first started out, it was only about 43% utilization, whereas now we're about 86% utilization. And we are able to track that actually within the Epic system as well. Managers actually be able to follow up on whether or not their staff is completing this workflow effectively and efficiently. We also noticed that nursing satisfaction increased significantly because we were able to do so much education up front. Once they actually got into their clinical areas, they were able to complete this workflow very efficiently and very quickly, and we noticed that visit prep prior to this space for an established patient was taking about 30 minutes, whereas now it's taking 15 minutes, where for a new patient it was over an hour, and now it's up to 30 minutes. So this workflow really streamlined how and what we were looking for our nurses, but really having that education piece up front before they even start working on this space made a huge difference. And now, because it is so well-rounded in our institution in our areas, our preceptors and our orientation onboarding folks are able to actually support new nurses coming in, so that way before they even come to the oncology ambulatory clinic class, they're able to have a baseline understanding of what this workflow is, and then during that class and office hours, we're able to put all the pieces together for them to make sense. With our evaluation, we really utilize that utilization metric, as well as just asking nurses how they feel about it, and then we also make continuous and ongoing efforts to make change in our class as it makes sense for folks. Especially in the beginning when we were having this class, it was a lot more intensive because it was a new workflow for everybody. So getting folks to actually understand what this workflow was across those 29 different clinical sites with about 500 nurses, honestly, was a difficult challenge. But at this point, we've now been able to make it so streamlined that again, it makes sense for everybody. We're also expanding this workflow, as I mentioned, to other clinical areas. Now we're transitioning on expanding it to our infusion areas, because we do have our infusion centers, but we also have something called care communities, where the patients have their visits and their infusions in the same room as they see their medical providers. So for those visits that are linked, meaning that there are a fusion appointment and a medical appointment, our clinic nurses are able to take on that duty. But for our unlinked appointments, where they're still going to that same area, our infusion nurses are now able to complete this workflow, and everybody has their own standardized checklist for what makes sense for their particular areas. So our surgical oncology has one, our nurse navigations have one, our radiation oncology has one, and medical oncology does too. So we're really excited that we're able to customize this type of workflow, and the education itself is the same across the board. The only thing that's different is that specific checklist. With this standardized education approach, again, we were able to get that nursing satisfaction and proficiency in the workflows that we were doing, but also we were able to tailor the program to our different disease groups, which made it a whole lot easier. Gaining buy-in from our staff, especially initially, was pretty difficult because we already felt like Epic was a difficult enough beast to try and transition into. So being able to do this and have that robust education for specifically what we do in our care areas, honestly, was a lifesaver. And some of our other educational methods that we're looking to in the future are potentially building out Epic education tracks, so that way it's already loaded for our new nurses coming in, but that will take some time. So we're just doing everything that we can separately to try and support our groups. But that's all I have. Thank you. So I'm an MPD specialist, so I specifically work on this clinic class. Eventually we are working on transitioning our model so that way our unit nurse educators are actually able to take on some of that responsibility. But since we are still in our infancy stages, it's primarily me and one of my other coworkers. Yes, we have about 20 new hires that come to the class, especially since we're doing it every other month. And then our office hours, it can be between 10 to 30 folks, depending on how and when they drop in.
Awesome, great job.
Absolutely, thank you.